Okay, you guys, so let me show you how easy it is to use the NurseBrain app, the NurseBrain Synapse app. As you can see, I don't have any patients right now or tasks or any notes. So to add a patient, I just go to the menu, go to patients, and I can add a patient. So let me go ahead and create, get some ideas on what type of patient to create. So we'll use the AI here, and I'll just say create a random detailed patient. Okay, and so this will process. So basically I'm doing this just so I don't have to come up with a fake patient on the spot. So I'll use the AI to create this for me. So select all, and I'll just copy this, and then I'll just exit. Okay, and then I'll go back to the menu, go to patients, add patient, and then I'll go ahead and paste this sample patient, and then hit save. So now what's going to happen is that the AI will go ahead and create an SBAR summary for this patient. It'll provide recommendations on what to look out for and things to do for this patient. Also, it'll generate a personalized checklist of tasks that need to be performed or interventions for this patient. And also, it will generate a progress note for this patient. So it'll basically give me a note that I can copy and paste for my documentation. So this is the sample patient, the random patient we just generated, John Doe, age 68, male, full code, etc. And here's the SBAR summary for this patient. We have the situation, the background, the assessment, and the recommendation. Also, if we rotate this, here we can ask questions on what to do for this patient through this chatbot. And then also, if we wait just a few more seconds, we will actually have suggestions and recommendations for this patient. So let's see, let's go ahead and just close this real fast. So let's reopen it. Perfect. So here we have actions to take for this patient and also observations to make. Remember, this is not a replacement for clinical judgment. This is just a tool to help organize your shift and provide the best care to your patients. Now, as you can see on the tasks screen here, now we have tasks which were generated automatically, personalized to this patient. So this is what the in-app AI is recommending for this patient based on the information that was provided. So we should do an initial assessment, check vitals, do rounding, do the morning care. That's tomorrow at 6 a.m. Do our last assessment at 6:30. We hand off, and we prepare for the handoff at 6:30, and then at 7 we go ahead and do the handoff. So what's really happening here is that the app, it knows that my shift begins at 7 p.m. and it ends at 7 a.m. So all of the recommendations for my patients will be within this time frame. Also, the AI within the app, it knows to bundle tasks. So it looks at everything that's going on within the shift, and it can make really thoughtful recommendations on which tasks, which interventions to provide and when to provide them and which ones can be bundled together. So for example, let's tap here on the initial assessment. So here we have the initial assessment and the critical interventions. And so here we have some subtasks or some mini tasks that we can do as part of this overall task. And then as soon as we complete, let's say, for example, the head to toe assessment, we just tap there and it's marked as complete. We'll do the vital signs and it gets marked as complete, etc. So we keep on marking each mini task as part of the overall task that has been created. And then once we're finished, the whole task will be considered as completed. Okay, and then we go on, so forth to the remaining tasks. This task here, the hourly vitals, so it says 0 out of 4. So this means that this task actually will be, it's a repetitive task, so it needs to be performed 4 times. Okay, so So it's the hourly vitals, the respirations, and the rounding. Also, if you notice in here in the description, each task that is created automatically comes with a rationale, so you know why the app suggested creating doing this task or intervention, right? And some tasks, not all the tasks, but usually some of the tasks they come bundled into like mini tasks or subtasks that you can do, as we mentioned earlier. Okay, so you can just tap to complete. Okay, and so now if you notice, now it says 1 out of 4. So we've completed one of those repetitions. So now there's 3 more remaining. Okay, and then we'll slide down and now we'll go to the notes screen. So we have our note. So this note here was automatically created for this patient, generated for this patient, John Doe. So we have the situation, we have the background, the assessment, and once again, the recommendation. So here we have the tasks that were completed for this patient. So in order to get the latest update on which tasks were completed, since we just completed a couple of tasks, we can just tap here on the top right corner and regenerate the synapse node, and it'll go ahead and regenerate that. Then also here we have the nursing care plan 2 as well. It is personalized to this patient, and it comes with 3 nursing diagnoses with interventions and rationales too as well. Okay, so this synapse node, it has been regenerated successfully. So as you could see under tasks completed, it shows that we did complete hourly vitals, and we also did complete an initial assessment. And also, if you notice at the bottom here, it has how many repetitions were completed and the time. So literally, you could just literally just copy and paste this. You can copy and paste this and use it as your documentation. It keeps track of everything you do for your patients, all the tasks, the assessments, everything, right? And so we don't know the patient's name currently. So the name is John Doe. So it's very easy to make changes to the patient. So we just tap here and we go to update. So let's change their name. We'll call them John Davis, for example. Let's say they're in room 235. Okay, and so if you notice, there's already information that was structured for this patient, and then we'll tap save. Okay, so now we've renamed this patient to John Davis, and if we take a look at the tasks, also they no longer say John Doe, now they say John Davis. And also the smart note, or the synapse note, actually the AI generated note, it still says John Doe, but it will go ahead and update once it's finished processing. So we'll check back in on that in a second. And so here for John Davis, so for example, let's show the in-app assistant that you can use. Okay, so the synapse node has been generated, so it should say John Davis. So we'll take a look at that in a second. But here we can say, what is the most serious thing I should look out for? Then we'll hit submit, and then it will go ahead and process that request and provide an answer. Okay. And so here for John Davis, that's the name now that we know who they are, we should look out for worsening hemodynamic instability or cardiac decompensation. Okay. And so this is just to offer some clinical decision support, just to help you feel more confident in the care that you provide to your patient. Also, whenever you make a change or whenever there's an update to a patient, whenever you hit update right here and then you hit save, the app keeps track of that. So when you click on this timeline icon here, the one that's in the middle next to the QR code, it will go ahead and show you a timeline of the changes. So here, the only change we've made so far was just renaming this patient. So as you could see, the name was changed from John Doe to John Davis. Okay, now let's go back to the notes. So now we should have two notes actually. So the first note was this note that said John Doe earlier. So this is the note that has the S bar, it has the tasks completed, and it also has the nursing care plan that is personalized for this patient. And then also this is this Synapse note here that says Synapse John Davis. So this first note, this is the log from the chat we just had with the AI, with the in-app virtual assistant for you that knows everything about your shift. And that's pretty much it. So NurseBrain Synapse, it handles all of your patient information, it handles all of your tasks, and it also handles all of your notes, everything. A lot of it is being done for you on your behalf automatically behind the scenes. All you have to do is just provide information about your patients, and the app will do the rest. One thing we didn't cover in this video, which we will cover in other videos, is that when you add a patient, you can also add patients simply by taking a picture. So just by tapping the import patient button right there, menu option, or also you can also dictate patients too as well. So for example, by dictate, it means that you can simply tap the option, and then the app will listen to whatever you're saying or whatever someone else is saying about that patient. It'll record that it'll record what they're saying, turn that into a transcript, and then create the patient for you. So this is especially useful during handoffs, so you can actually be more present and focused on what's actually happening. So for example, just tap here, and as you can see, the app is listening to what you're saying, and then once you are finished, you can just tap submit, and that's all you have to do. So you can literally almost just use all of this app hands-free without even having to really enter in a lot of information. So there are several ways to really use this app to streamline your shift, to help you stay on top of things, stay organized, stay on time, be more confident during handoffs, during rounds, and just be more confident in the care that you provide to your patients. And a lot of this, as you could see, it was done automatically. Okay, so this is just a quick preview, quick tutorial on how to use the NurseBrain app without using the voice dictation feature or using the import feature. You can just go to the menu, go to patients, add patient, enter information, anything you want. Or if you prefer a more guided approach, then you can fill in the fields and choose the appropriate options, and go from there, and then hit save. And then after hitting save, your patient will appear here on this list, and tasks will be generated. Personalized tasks will be created for that patient, and also a smart progress note will be created for that patient too as well. Thank you for choosing NurseBrain Synapse to simplify and streamline your nursing workflows. Thank you for all you do for your patients. We appreciate it. From one nurse to another, thank you, and we'll see you next time.